Originally, I did my undergraduate work at the University of Missouri, and I was a softball player for them. I injured my ankle my last year of softball and had a wonderful orthopedic surgeon and PA take care of me. So that's kind of where it sparked my interest. And then I went to Wake Forest School of Medicine for my PA studies and ended up in Wilmington doing some rotations. Loved it here and haven't ever left after I did my rotations here. A lot, because I'm getting older and my body's starting to break down. So patients come in with complaints and I can usually say, you know what, I've had something similar, and or, you know, we had this with, you know, so-and-so, so-and-so, and we can kind of relate back to here's how we treated it, here's how we did this, or here's what worked for me. This was kind of what I recommend. But yeah, just experiencing it and seeing it on the athletes that I've been around and worked with kind of helps me program it specifically to the patient. I'd say most of the things that we see right now would be the arthritis in kind of the middle-aged elderly population, but we're starting to get a few more of the athletes with football starting up now. So typically the arthritis, lots of shoulder injuries. We just had one today that came in from Defy Gravity, which is a great new thing for orthopedists because we get to treat the patients who get injured there. Lots of ankles, lots of knees, lots of shoulders, the typical things that you would expect from weekend warriors and athletes, but also lots of arthritic things as well. The first thing I'm going to ask is, you know, mechanism of injury. How exactly did this happen? And then what are your job requirements? What are the athletic things that you want to get back to? What do you like to do? And then trying to base a good treatment plan off of that so that we can get them back to where their level of play is the same as what it was before. Just kind of getting a feel for, you know, who they are, what they want to do, and figuring out physical therapy for the athletes is usually going to help them get there faster, whereas with some other ones, just plain old time is going to take care of it on their own. All PAs and doctors want to be a team. Dr. Jarrett's fairly new to town, so I'm still learning some of his techniques, but for the most part, you know, with orthopedics, everything's about the same. But with some of the new patients, I want to kind of do the exam, get an idea, but if there's a surgery involved, I'm going to bring him in right away so that he can be interviewed by the patient as well as him interviewing the patient too, to make sure that they're a good fit. Teeing the patients up, me getting the MRI when I suspect there's a rotator cuff tear, and then he's seeing them after the MRI comes back to discuss surgical intervention, those types of things. I kind of consider myself the pre, and then he's going to do the actual procedure in the post, if that makes sense. Especially seeing that last visit with the athletes when you get to tell them that they're ready to go back to playing, and you know, sometimes they'll even give us a little, you know, headline in the newspaper that said, look what I did. If I get a little feedback from one of those patients that I've treated and they're back to playing and they're excited, that to me is just awesome, because once again, that's really what we want to do, is get patients doing what they love, and then that reflects back on us so that we can say, this is what we love too.